so as I said before, a bit of a different group. So as was introduced, we're going to be thinking a bit more in terms of the place or locality. Our remit is Harrogate. So I'm sure we'll all bring different perspectives into the conversation, local ones, but also region-wide as well. So I think I said before Helen was in the group that I was in before, I said we were going to use a sort of hand-up approach, but I think there's not too many of us. So I think if you want to add something, just take yourself off mute and we'll just respect each other and try not to talk over each other, although inevitably in these situations that might happen. So what we're going to do is have a think about the sort of key barriers and levers or drivers to building more inclusive digital transformation. And then once we've had a think about those things, we'll use that sort of context and the context from the rest of the afternoon to identify some of the key priorities and action steps that we could take next. And that will all be fed back to Dawn and the team, and we'll sort of form that project that will go forwards. As I said before, some of them may be sort of location based and Harrogate, or some might be wider, and the main thing is we need to take back a list of, or a small list of, key priorities from our discussion. So I think it makes sense to start with barriers, and I don't know if people want to just I'll keep some notes if people want to just sort of speak up, I guess, if you can think of some obvious barriers, and I think we probably covered a few this morning.
Kirsten, it's Neil Bartram from North Yorkshire County Council. I've got some of my colleagues on the call as well. It's not necessarily a barrier now, but it might be one. And it was something we talked about in that earlier session just now. Across the Harrogate place, there could be many organisations all trying their best to improve people's digital inclusivity and all doing what they think is the best thing for their organisation by providing help, support, equipment. And I just wonder whether or not we need to coordinate that activity so that we're not overwhelming citizens with so many offers of different types of support that they actually just don't know who to turn to.
Mm-hmm. What do others think about that?
I agree with Neil. Mm. It's we're about to kick off a skills programme focused on digital inclusion, and part of the work we're doing there is to train the voluntary and third sector as well as our own staff to deliver that. Part of the reason is to avoid the point that Neil was making, that another call to arms and trying to raise volunteers to be more digital champions is something that I think the stretched third sector doesn't really need. There are a limited number of volunteers, although I think we're very well served in North Yorkshire and Harrogate. So the plan is to train what we have in front of us rather than to recruit, and then that will help take, I think, some of the pressure off competing objectives. You can work with people like Harrogate supporting older people who are, and have done for years, doing work around engagement and supporting lonely people across Harrogate, and if they're now digitally trained, it means they can move to Zoom or Teams or whatever, engage people on that level. So I think that's a step forward. But yeah, I agree with Neil that the danger is we get too many messages coming from different angles.
Yeah, it's interesting because we started from the point of a barrier, but I guess it could also be an enabler. The fact that there are, lots of organisations that can join up and form a much stronger position as well.
Yeah, I think it's more just about the citizen, the person at the other end of all these digitally enabled service or digitally accessible services. That's just one person, but they will have to deal with multiple organisations. And one of the sort of pre-digital scenarios is that 3 or 4 different organisations all send somebody in the public a form to fill in, and 95% of the form is exactly the same. And you would often say, why can't you just send me one form that serves all of your needs? We've got to try and avoid just creating a digital equivalent of that by sending 2, 3, 4, or half a dozen different devices to people when actually they're trying to do the same thing just with different organisations. Mm-hmm. I've not got the answer. I'm just saying it might be a potential barrier that we have to overcome.
Yeah, absolutely. Has anyone else got any thoughts on other barriers?
I think the other one is the barrier is not offline, online. I think, as was said in the previous one, there's a a cohort of people who are online, but actually not equipped to be online, so don't maximise, and they sometimes get forgotten within the great mix of what we do. So again, within North Yorkshire, we've mapped different internet user classifications to give us a better understanding of what those levels are. So we've used the 2018 internet user classifications. I think London have done something similar, and that enables us to talk about e-withdrawn or digital seniors or the youthful urban fringe, and just classify people in different areas. When we're creating those personas and user journeys, it's important to know who we're talking about. And we've had some good success in the work that we've done. So like our blue badge is 98% online now. So as a area that's focused on people with disabilities, is we took a lot of time to work with those groups to prototype and to work it through, and I think it's been it's borne fruit in the uptake and how it's used. Bus passes for seniors as well is also in its high 90s, so it shows the approach works. It just takes time, and at times time is a very limited resource, and being able to point at successes like that, I think, is really important.
Do you think there's just thinking of what we've said about things being more joined up, but I guess organisations will be learning about user needs and personas and things. Is there a way, I'm just thinking off the top of my head, is there a way we could better share that information so that when we're thinking about different groups of people, we kind of, could form these into a bit more of a log and share that learning amongst the region that we're working in?
Yeah, I mean, we're happy to share anything. I think the challenge is how it gets shared, and that people have the time to take the lessons. And some of it is about doing it. At a recent meeting, I made comment around some of the work around these sessions, because I think a lot of local authorities were probably in this game sort of 5 years ago and having these types of discussions. So it feels like the NHS is playing a little bit catch up on some of these services. So again, I think there's a whole host of things that GDS and local authorities have done in this area that the NHS could learn and stand upon, and not least some of the examples we've heard from in the previous sessions, really. But yeah, it's sharing is the art to all of this, but it's not just sharing, it's actually seeing what's been said and building upon it rather than starting again.
Yeah, and that's kind of the main reason we're all here today, isn't it? Okay. Any other barriers before we sort of maybe start thinking about the priorities and things like that? We've missed as well the leavers or drivers. Anything people want to add to that?
I think one of the drivers is the last 6 months, how people have adjusted to a more digitally enabled way of life, whether they were doing that beforehand or not. There does seem to be a lot of emphasis now on being able to access things, order things, discuss things. Even as simple as getting the shopping delivered might have been alien to some parts of our communities before lockdown. It was made essential during lockdown. So it's bad to say that the crisis has created this. We'd have liked to have got here through a slightly different route, but we are here now, and it's a question of capitalising on it, really, and just making sure we don't lose that momentum.
I was interested in hearing, you talked about not recruiting more champions, about training them. I was interested in what kind of champion approaches have you found most effective?
Is that for Neil?
Well, for anyone in the area, because there's lots of different ways, kind of approaches to champions, and I think that really, really important. It's just wondering what's most useful.
I think they all work. So I think it's what happens on a local level. It's I think I've been around this area for a while, long before the good things were called the good things, and Helen Milner's work there, and the work in libraries, and even now local authorities libraries do some really good work around that digital champions. I think that where we're at the moment is you want to push digital inclusion and tip people over, and it's always go out and recruit digital champions. Well, we're out recruiting champions, volunteers for a load of other sectors, and it's just one more noise, which is why we've taken the approach we've done. But if you're in an area where there's not a lot of volunteering and the volunteer well is still very full, then it might be worthwhile recruiting more digital champions. We've just taken the approach that we are very well blessed with a large array of existing champions and giving their time for a whole range of things. If we can up their own digital capabilities, then they can pass those on, and that goes for our own staff as well. You know, if you take the County Council, we've got 1,000 people working as home help and social workers in that older end of the market. If they can be in and they do know the name of the pet or the football team, as an example was used before, and say, well, actually we've heard this app is a good help and can work, why not, then why shouldn't they do that? So that's what we mean. So for us, digital champions are our customer services, they are our librarians, they are our home care team, they are our social workers, as well as the voluntary and third sector who are out there doing this job as well. And if we can aggregate our own demand and our own sort of buying capability to reduce some of those costs for them to upskill, then that's the approach we need to take, rather than probably yet another call for more champions. It's a bit like the Intel Inside. You know, we want our volunteer and community organisations to almost have digital inclusion training in everything they do. So it just becomes second nature, and that's what we're sort of looking at as an approach.
Helen, I wonder if the sort of publicity around Barclays and their digital eagles has got people thinking that you must have specific digital champions rather than your existing champions, your existing community workforce with a digital angle to what they do.
Yeah, and also I think critically there's people working in the NHS, particularly in primary care, that in the same way that you described, that it's just it's an integral part of what they do. Yeah.
Okay, I think that's really really helpful for maybe us starting to think about what we want to sort of add on to this list of the priorities. Then I guess one of the things I heard there was around digital inclusion training. I don't know if that's something we want to consider perhaps as a priority, and the fact that that's a very wide requirement that's perhaps needed. I don't know what you think about that, or if you've got other ideas.
I think in terms of health and care, professionals, I'm aware of something that's active now by Health Education England. Mm-hmm. It was originally titled the Building a Digitally Ready Workforce, but they've rebadged it slightly now. But I think that's aimed at getting the digital skills of the workforce up to a level where they can be much more confident when they're actually out and about doing their normal day-to-day. I'm just trying to think of what its new title is. I was trying to find it. It's the Digital Readiness Programme. I don't know if that's any better or worse than building a digitally ready workforce. But there are some people in Health Education England who are doing some quite exciting work in terms of how you do get that into the workforce.
Okay. So maybe that one's already something that we can, like you say, draw on other resources rather than starting from scratch.
Yeah, I think that's what I would probably suggest, really. I think in this area there's an awful lot of good stuff out there. So we're working with Digital Unite and Citizens Online to do the work we're doing, and they've got some great stuff, and I would advocate that we draw more of this stuff together and then use what limited resources we have to fill in the gaps and to do that work rather than potentially recreating what already exists. I mean, if we can make more of that stuff more widely available, it's a benefit to us all because, resources are tight. So.
Kirsten, I wonder if that's one of the priorities then, is to try and establish some sort of a repository or a deposit or a place that people can go to find out what existing activity or resources have already been reproduced.
Yeah.
In a digital world, I think we should be able to do that in a digital way now.
In theory, you'd have thought so, wouldn't you? Yeah. Okay, great. So we've got one. What else do we think? Key priorities for how we sort of take this forward.
I've still got my outstanding annoyance about coordination. It will be difficult if we all start approaching this separately and in an uncoordinated way. I just think we can make it easier for all our organisations and our citizens ultimately if this can be dealt with in a much more organised way.
Mm-hmm.
Yeah, I would second that. So it's looking at the examples. So you've got Leeds Council, you've got Kirklees, and you've got 4 North Yorkshire County Council people on here, and we're all saying the same things. We're all doing this now.
Mm.
So I think the key is that the NHS, and I know it's labelled health and care, but there's not a lot of care as in how local authorities would view it in the discussion so far. And that's not criticism, it's just how we've seen it's very NHS focused, is building what's already there.
Mm-hmm.
And you know, we've not really done the co-production or the co-design. Well, that co-production includes stakeholders as well. So if you talk about a piece of information, how it's travelled and the work around the care record, local authorities, community sector and the NHS are all part of the same sort of customer journey on some of these things, and viewing it as such, I think will help, because we've all got a different role to play in different spaces. And one of the points that I've raised before is we as an organisation have done an awful lot around delivering broadband to North Yorkshire. So I think North Yorkshire, without our investment, would only have 50% coverage of broadband, particularly superfast that's capable. And we've spent around £75 million of public sector money in driving broadband through. So again, this is something else that's often forgotten, that it's all right if you sat in Leeds, your connectivity's there, but if you start getting out into the wilds of Kirklees and Calderdale and North Yorkshire and areas of Bradford, connectivity is a real issue. And how do you cover that gap? And it's not as easy to say stick a 4G dongle on it, because there's plenty of places that don't have 4G signals. So we often talk around sort of the different columns of a digital strategy, and skills is a part of it, connectivity is another. And the point that John made, John Beach, and I should state that I'm a director at the same company John is, and Solidaritech, is connectivity is a real issue. And we know from where we sit now, if you're not interested in broadband, you know, why would you have connectivity? If you're older, we have a better chance because older people have fixed lines, so the incremental cost of broadband on top of that, what, £6 a month? But if you're younger, you don't have fixed line, then you're talking around how do you add data into mobile, and that point around video conferencing is a real one. And we found it with our kids in care and the rest of it.